Every year, many people go home from the hospital with a feeding tube. It can feel scary and confusing at first, but you are not alone. This video will show you simple steps to care for your nasogastric tube safely at home. A nasogastric, also called an NG tube, is inserted through the nose into the stomach to be used to provide nutrition, hydration, and medications. Hello, my name is Lana. I am a nurse in the radiation department at the Ottawa Hospital. In this video, you will learn how to keep your tube clean and safe, how to handle feedings and take medications, and what to do if you run into any issues. First, we'll start by washing our hands. This is the most important step before touching your tube or any supplies to help prevent any possibility of infection. Use soap and water or hand sanitizer. Take a moment to gather all the supplies you'll need: measuring tape, formula, 60 milliliter syringe, tap water at room temperature, clean feeding bag and tubing, extension set if using, pole or hook, liquid dish soap, pump if using. Before every feed or medication, check that your tube is in the right place. Use a measuring tape to check the length from the tip of the nose to the catheter hub. The catheter hub is the clear plastic at the end of the tube. Do not measure the extension set. If the length has changed by more than 2 centimeters from the initial measurement, do not use the tube and call your nurse or doctor for help. Before and after feeding or giving yourself medications, flush your tube with water as directed in your feeding plan. Use room temperature water with your 60 milliliter syringe. Flushing helps to keep the tube from getting blocked. Be sure to follow your feeding schedule. Only put formula or water into the feeding bag. Never put medications, juice, or food in the bag. If you use formula from the fridge, let it sit out at room temperature for 30 minutes. Never use cold formula and do not heat the formula. To set up a feed, close the flow regulator by rolling the wheel downward. Gently shake the formula and pour it into your feeding bag. Hang the bag on a pole or hook above your head. Remove the cap from the feeding bag tubing. Gently squeeze the drip chamber until it is half full. To remove air from the tubing, open the flow regulator by turning the wheel upward, then let the solution flow through the tubing until it reaches the end. Then close the flow regulator and put the cap back on. Connect a syringe filled with water to the feeding tube or to the extension set if you're using one, and be sure to open the clamp. Then flush your feeding tube with water. Close the clamp on the extension set before disconnecting the syringe. Connect the feeding bag to your feeding tube or extension set and open the clamp. Slowly open the flow regulator of the feeding bag until the feed is flowing well. Follow the feeding schedule given to you by your nurse or dietitian. Adjust the flow by slowly turning the wheel up or down. Keep the tip of the feeding tube clean. Always keep the feeding bag higher than your head so the formula flows easily. Remember to remove the cap before connecting the syringe for water flushes. During the feeding, sit upright or with your head raised to a 30 to 45 degree angle and stay upright for 30 to 60 minutes after feeding. This helps prevent nausea, reflux, and reduces the risk of formula coming back up and going into your lungs. If you are using a feeding pump, follow the instructions from your home care nurse. Once the feeding is finished, close the flow regulator on the feeding bag, turning the wheel downward, or turn off your pump. If using an extension set, make sure to close the clamp to prevent any leaking. Open the clamp again and flush the tube with water as directed. Close the clamp and put the cap back on the tube. Clean your feeding bag, tubing, and syringes every day. Use warm water and a drop or two of liquid dish soap. Rinse well and let the supplies air dry. Store the feeding bag in the fridge between feedings. Do not put feeding supplies in the dishwasher. Take your medications as directed by your doctor, pharmacist, or nurse practitioner. If you are able to safely swallow, you may be asked to continue taking medications by mouth. If not, you will be shown how to give medications through your feeding tube. When taking medications by feeding tube, it is important to only crush those tablets or open capsules for your medications that you have been directed to take. Give one medication at a time through your tube, flushing the tube with water before and after each medication. Never mix medication with formula. Every day, check the skin around your nose and the tube. Look for any redness, swelling, pain, or fluid leaking. Gently clean the area with mild soap and water. Be careful not to pull on the tube or loosen the tape. Make sure the tube is securely held in place with the securement device or tape provided by your nurse. Check that the tube is not rubbing inside your nose. Too much rubbing can hurt your skin. It is important to continue doing your oral care, including rinsing your mouth, brushing your teeth, and flossing as instructed by your care team. If you notice any problems, call your nurse or doctor. If the tube length changes, if your tube falls out, is blocked, or you feel sick or are vomiting, stop the feeding and call your nurse or doctor for help. If you start to have trouble breathing or experience chest pain, go to the emergency department right away. You can safely care for your NG feeding tube at home by following these steps. Remember, it's okay to reach out and to ask for help. Your nurse, doctor, and dietitian are here to help you stay safe and healthy. Thanks for watching.